I'm going to begin by verifying my order, so an order for routine central line care per unit protocol, and I'm going to verify my order with hospital policy, and I am going to wash my hands, gather my supplies, and then I'm going to ensure that I have the right patient. So I have Jaguar Jones on my order form, Jaguar Jones on my bracelet, medical record number 4176352 on my order form, medical record number 4176352 on my bracelet, allergy to penicillin on my order form, allergy to penicillin on my bracelet, and then I'm going to ask the patient, are there any other allergies that I should be aware of today? And then the patient would answer accordingly. And then from there, I'm going to explain the procedure to the patient. So today I'm going to be performing central line care. I'm just going to remove your old dressing, I'm going to clean, and then I'm going to be putting a new dressing on it today. Is that okay? And then the patient would say yes, and then I would provide for privacy. I would perform hand hygiene, gather all of my supplies. I would put my patient in a comfortable position, the bed up to a working height, the side rails down. I would lift the head of the bed slightly elevated, and then I would make sure, like I said, my patient was comfortable. And then put all of my supplies onto a bedside table, and then I would raise the bedside table up to my waist level. Since this table is not at my waist level, working beneath my waist today would be a break-in sterility. Okay, if I needed to obtain a culture, what I would do would be, if there was any drainage with pus, if there was anything like that, that's when I would obtain a culture. So now I'm going to inspect, perform hand hygiene, and then inspect and look and see if there's any redness or drainage, and I'm going to palpate for any tenderness or swelling. Okay, and then from there I'm going to again perform hand hygiene, put on my goggles and the mask. Then I would assist my patient in putting on a mask as well, and then just kind of set that up towards the head of the bed. And then I'm going to put on clean gloves. Okay. All right, so now I'm just going to begin with removing this old tegaderm. So I would peel from the outsides in towards the insertion site. So I'm going to lift up on the edges and lift towards the center. Lift towards the center. And then towards the middle. And then I would, my glasses are fogging up. I would inspect the site. I would look for any redness, drainage, or swelling. I would look at the dressing and see the type and amount of drainage if there was any. And if there is drainage, that's when I would use a culture swab, and I would obtain a culture and send it to the lab. Okay, so I'm going to get rid of my dressing in these clean gloves. Okay, I would perform hand hygiene, and then I'm going to open my sterile kit. I would open that away from me, and then I'm going to remove the contents of my sterile kit, and I would throw that away. And then I would perform hand hygiene, and then I would open my sterile kit away, outside, outside, and then towards me. Okay, and then from there, perform hand hygiene again, and I'm going to don sterile gloves. After my sterile gloves are donned, I'm going to reach into my sterile field and grab a clean alcohol swab, and then I'm going to want to hold my central line down, and I'm going to clean around it in circular motions, being sure that I don't go over any part that I've already cleaned, and that I get as close to underneath the central line as I can. And then this hand is not dirty and this hand is still sterile, so I'm going to throw that away. I'll pick up my chlorhexidine, and with this I'm going to clean everywhere, just being sure not to touch again beneath this green mark. And I'm going to clean all around the skin. I'm going to clean on top of my central line. I'm going to clean underneath it like this, all around the insertion site, all around the surrounding skin. And then once I feel like it's good and clean, I'll allow it to dry for 30 seconds. I'll throw away my chlorhexidine and use my sterile hand to grab my my BioPatch. Without touching my patient's skin, I will place the BioPatch on to and around my central line and the insertion site according to hospital policy, so that the blue side with the writing is up. I'm going to pick up my Tegaderm, and I would open this if it was in a pack with sterility, being sure to apply it like a Band-Aid, but since we don't have that today, I'm just going to work with what I have. So I'm going to apply firmly like this, and then smooth down and around this way, and smooth down like that. And then from there, I'm just going to pick up my supplies. I would take off my gloves, take off my mask and my goggles, and assist my patient in taking their mask off. I'm going to take a piece of tape in which I'll write my initials, the date, and the time on. So I have my initials, today's date, and the time. And I'm just going to stick this on the dressing, being sure to avoid the insertion site. And then from there, again, just perform hand hygiene. I would put my patient back down in a comfortable position with the head of the bed where it's comfortable at. I would ask the patient if they need anything, make sure that they had their call light. And then when I go back for documentation, I would document the location of the central line. I'd document if there was any drainage or pus coming out of it, if there was any swelling or redness. I would document if I obtained a culture. I would document the type of cleanser used on the central line, and then I would document how well the patient tolerated the procedure. And then that concludes central line care.